Okay, welcome everybody. Krista and I are very excited to be here at your kind of kickoff supervisor training. We're going to talk to you about supervision training models and specifically the reciprocal engagement model of supervision. So just to kind of get us started today, neither Krista nor I have any conflicts of interest to declare. You can find the whole slide, all the slides, as well as two handouts that we're going to have, either with the QR code that's in that kind of right side, or at that link that I've provided in the chat. But if in-person folks, z.umn.edu/UW Supervision 2022. And with that, I'm actually going to let Krista introduce herself first.
Good morning, afternoon. I'm so confused by your all time change. I don't understand time change. So hello, happy Saturday, everybody. Thank you to everyone for having us join this morning. It's particularly exciting to speak to other programs, and I particularly enjoy hearing kind of the questions that are coming from you. So myself, Krista Redlinger-Grossi, she, her pronouns. My role at the University of Minnesota program is directing fieldwork and supervisory training. So intimate knowledge of sort of how we need to support supervisors, because ultimately you are doing really hard work with our students in terms of this critical fieldwork component. My background, for those that don't know me, I received my genetic counseling training through the Hopkins NIH program, and have worked clinically and supervised clinically, both in prenatal and metabolism. I also went back and did a counseling psych PhD, so also work with patients and families in a private practice who are impacted with genetics and dealing with genetic risk. So that's a bit about me, and thanks again for having us.
And I'm Ian McFarlane, he, him pronouns. I am Director of Admissions and Associate Director of Research for the Minnesota Genetic Counseling Program. I am not a genetic counselor, but a psychologist who's been working with genetic counselors for almost 15 years now. And I study clinical supervision and professional development broadly, but in particular dynamics in the relationship between supervisors and supervisees and how that impacts training and outcomes. So we are very excited to be here. And again, thank you to the leadership group for inviting us to be a part of this. So our agenda for our component of your training today is that we're going to start by, big picture here, defining supervision broadly, but then also getting more specific in terms of the reciprocal engagement model and talking about the components. Because, we're really, when Penny asked us to come, we're really thinking about setting a foundation here for not only this training today, but future trainings, as the UW program is going to really be emphasizing this model and zooming in on different parts of this over the coming years. And so we wanted to make sure that you have a real firm understanding of the basic model that you're going to build all these other layers on. And so as we lay this model out today, we're going to ask you to reflect on what aspects of your experience of supervision align well with the reciprocal engagement model, and which places will be new or different that you may be asked to think about in a different way. And then lastly, we really want to explore the centrality of culturally engaged practice. You'll see that the reciprocal engagement model is built around the relationship between supervisees and supervisors. And so understanding cultural dynamics and social justice issues is centered in this model, which again aligns really well with the UW program mission and goals. So that's what we're going to do. We're going to do all this in an hour. So we're going to go pretty quickly. But ask us questions. Feel free to unmute and jump in or put questions in the chat. Krista and I will be monitoring the chat throughout. And again, we want to make sure you get as much out of this as you can. So, defining supervision. This is, Krista and I will always define everything as we're talking about it. It's so important to have a common understanding of terms, right? We have to make sure that when we're throwing things around, that if everyone's not on the same page, we're going to end up in different places. So Bernard and Goodyear from the mental health literature have really kind of the classic definition of supervision. And it's really about an intervention from someone more senior or more experienced, or I think in GC circles, we call it spicy, seasoned, spicy, members of a profession to a more junior member, right? Or someone coming into the same profession. Okay. We know that it's evaluative, extends over time, and then has these two purposes of both enhancing the professional functioning of the trainee, the supervisee. We're trying to get them to a place where they are competent to practice independently, but also a gatekeeper role and making sure that the folks that we are shepherding in and welcoming into our field of genetic counseling are going to be capable of performing at that competent level. And interestingly, supervisors often think first about that professional functioning goal or task. Students are often thinking about the gatekeeping role that you play first. And so, remembering that, for those of us who were trainees not very recently, sometimes we can forget how big that pressure is. And one of the ways that, or one of Krista and I's really kind of goals for supervisor training is to steep this journey into becoming an accomplished supervisor in theoretical models. We know from the genetic counseling literature that most people who are supervisors have kind of figured out what they're going to do based on trial and error, feedback that they get from students when they get it, talking to colleagues, or their experiences either as when they were a supervisee or experiences as a supervisor. Okay, so very rarely are folks actually leaning out and trying to figure out kind of what's the theoretical reason for why we're doing this, and having a model that guides practice. Okay, which is why we're so excited to be brought out to the UW program to kick off this professional development opportunity for all of you as you grow as supervisors with the program, and as the program grows with you, to be guided by a specific model and systematically enhance different areas of your supervision practice. Okay, so the model that we're going to introduce today is really going to be the hub of how UW frames its trainings. And at least at the Minnesota program, Krista is notorious for starting any supervision training with a reminder about the REM-S, right? And how what we're doing in that day is going to fit into this overarching model. And as much as people sometimes roll their eyes a little bit at Krista, like, oh, here we go again, right? It really does reinforce and helps make connections between why these different components are being stressed and how it all fits into a bigger model. Right, which is just like what we're doing with our students, our supervisees, right? We're helping them gain these little pieces, the PBCs, right? We're training them in these really specific types of contexts with the hopes and the goal of putting it into a larger scope of practice, okay? And understanding how it all comes together. And that modeling in the supervision relationship of how to interact with patients is something called parallel process. And that is something we will return to again and again today. Again, a term that really comes out of the mental health literature, but certainly has a lot of applications in the genetic counseling field. So without further ado, I want to jump into the model because we want to get you using this thing. And so The REMS, or the Reciprocal Engagement Model of Supervision, was put forth in 2015 by Colleen Worley as part of her thesis project here at the University of Minnesota. And it's really what they call an isomorph of the reciprocal engagement model of genetic counseling, right? So, the idea of, as supervisors, right, you are learning to apply the same types of skills and practices that you use with patients or clients, and using those skills in somewhat similar and then slightly tweaked formats with supervisees. Okay, so on the left here is the reciprocal engagement model, which was put forth by McCarthy Veach and colleagues back in 2007, and is the kind of the guiding model for genetic counseling practice. It's built around the relationship between the genetic counselor and client, and it has these interacting and interrelated components of education, right, providing genetic information, the individual attributes, like focusing on what the genetic counselor and the patient are bringing to the session, and then getting to genetic counseling outcomes. And those are all interconnected and center around or rotate through this relationship between the genetic counselor and the patient. Coming over to the right side of the model, then, the reciprocal engagement model of supervision, right, has the same components, except we subbed in supervision outcomes, right? And so it's modeled very much the same way, right? Which I think in some ways is really helpful to clarify, but in some ways can be a little confusing. And sometimes we think, well, working as supervisors, we're just doing the same thing as we do with patients, right? But it is a slightly different skill set, or at least you have to think about these skills a little bit differently. Okay. The idea here, again, is that we are going to walk you through this model. There are lots of, one of the things I like about this is it's a model of practice and it guides practice, but it's not necessarily specific to any particular kind of orientation, right? It works kind of however you tend to practice, right? If you tend to be more on the psychosocial side or more on the educational side, it works depending on if you are in a clinical position, a laboratory position, an industry position, okay? And so these components are always going to be there, right? Our skill sets as genetic counselors, providing education, using the relationship and understanding the attributes and the components that each person is bringing to lead to a set of outcomes. So each of these major spokes on the triangle and the relationship itself have these tenets associated with them. And so these are kind of the big picture components and goals, kind of the platforms, if you will, on which the reciprocal engagement model is built. Okay, and so we're going to go through each of these a little bit quickly, but I want to just kind of make sure you get a sense of what's really in this model. So for each of these tenets, there are also corresponding goals. So there are 17 goals associated with these 5 tenets. So to walk you through each of these briefly, and these are all in the handout, in the slides, if you have the slides. Also, we provided a handout that just has a table of the reciprocal engagement model goals, tenets and goals. And in that handout, you'll also see that there are supervision competencies paired with these. So Eubanks, Higgins, and colleagues in 2013 published a set of supervisor competencies for genetic counselors. And part of what Colleen Worley did was putting together kind of which aspects of those supervisor competencies relate most closely to each of these goals and tenets. Okay. So in tenet 1, we're really focusing on applying genetic information. Okay, so this is the instructional component largely. We're teaching our supervisees the knowledge that they need to impart. We're honing in on specific skills like risk calculation, like communicating results. And then we are looking into how they apply that knowledge and skills. Okay? And part of that is knowing what we need to give our students, our supervisees. Sorry, I want to be clear. I'm trying to use the language supervisees because not everyone we supervise is necessarily a student, but this is a new kind of terminology I'm trying to get in the habit of. So forgive me when I slip and say students, but I'm intentionally trying to speak of supervisees or trainees. The knowing what information to impart can be particularly tricky, right? And this is where we need to think about customizing and tailoring our supervision to the developmental level of our student, right? Our supervisee, here we go. And thinking through then, how are we tailoring, similar to how we tailor information to patients. Okay. In the next tenet, which is the relationship is integral to the genetic counseling supervision. We're going to talk about student and supervisor establishing bond, right? Having a connection, right? The kind of core of that relationship. And then good supervisor-student communication. Now, the model isn't super clear in what they define as good supervisor-student communication. But I think some of the things we can talk about here is like open and honest communication that goes both ways. It's recognizing and managing potential conflicts as they come up in relationship. It's making sure expectations are clear both ways. So I think we can think about how to operationalize that. But as we think about good communication, there's a lot of opportunity to dig further into that. And then thinking about mobilizing and utilizing supervisor and student characteristics to positively influence that process of building this relationship, right? And that's one of the places we'll talk about making sure that we're really thinking through identity and cultural understanding so that we can have a positive experience and use culture and identity as to enhance supervision rather than something that can be just a potential stumbling block. Okay. In tenet 3, student autonomy must be supported. Okay. Here's where we talk about this idea of entrustment, right, from the medical literature. So being able to turn pieces over to students so that they can be guiding their training and they can be guiding their development. Now, as supervisors, we're still responsible for, making sure that quality practice and competent care is being provided to all of our patients and clients, right? But as in our role of supervisors, that goal of enhancing the professional functioning, right? We got to think about they can't do that unless they have some autonomy. Right, so thinking about autonomy from day one and how we're talking about that is the first goal. Thinking about how do we integrate professional, personal, and cultural context into the supervision relationship. Now, I do want to point out this is the only place in the entire model that culture is explicitly mentioned. Although as we'll get to later in the presentation, we certainly think that culture is rampantly impacting and implicitly connected in many of these components. This is the only place where we get an explicit mention of culture. This idea of student empowerment or self-efficacy, their belief in themselves, and giving them a sense of feeling in control. Now, again, depending on the developmental level, the degree to which they're empowered and the degree to which they're autonomous should vary across their training. But I'm sure folks who've been supervising for a little bit now can see that student beliefs in themselves greatly impact their functioning. And some of our students have very high perceptions of their skills that don't always match, but even more commonly, it seems like they have very low expectations and feelings of self-efficacy when really they're doing awfully well, especially given where we expect them to be in their development. And then lastly, facilitating collaborative decisions. right? There are times when we have to, as a supervisor, say this is how it has to be, right? But in general, can we be working towards collaborative decisions about care? And especially as students are getting further in their training, how are we introducing and incorporating their perceptions of how care should proceed? Students are capable. Again, this gets a lot back to that self-efficacy, so that we have to oftentimes believe in our students before they will believe in themselves. Supervisees, excuse me. And then again, it's not helping me with this transition to supervisee language that the model says student. But recognizing our supervisee stage of development, right? Doing ongoing assessment early in the rotation and the whole way through, right? So that we are customizing and tailoring what our supervision style is going to be to what is appropriate and what is going to be effective with this student at this point, right? And then we can give those students that confidence, help them earn that confidence in themselves, right? And by fostering this is sometimes the greatest gift we can provide as supervisors. You know, they may not remember where they picked up a certain explanation or a certain handout, right? But they will remember long time into the future the supervisors where they felt supported and where they felt comfortable and confident, and the ones where they didn't. So thinking about, you know, what is our legacy? And it's not just the evaluation that dictates that. And then lastly, student emotions matter, right? So we have to have that relationship in order for this first goal of supervisor and student to both know the supervisee's concerns, right? Whether that's concerns about anxiety or boundaries or fears of evaluation, or if it's, I don't understand how to run this or explain this test, right? And we need to create a relationship that's strong enough to allow for vulnerability on both sides. And understanding the supervisor student and the student patient dynamics, again, getting back to that relationship is key. And so this is part of how do we train on that? How do we help our supervisees to recognize their own reactions to sessions and use that as a clinical tool? And then how do we address the students or supervisees' feelings and responses to the supervision process itself? Okay, that is a lot, right? And our goal today is not to make you experts in all of these things, but to give you kind of this quick level overview for you to start thinking about where are the points where I can already see I'm doing this is an active part, and where are the parts where you're starting to say, huh, I haven't really thought about that, or I don't know that that's a strength of mine. And again, as a parallel process, right, you're working with students, with supervisees, to get them to a place where they can go from having some natural and instinctive talents to being able to apply the practice-based competencies in a way that promotes and engenders competent care, right? So as supervisors, you're scaffolding the student experience, right, to make them more independent day by day, week by week. Give yourself the same grace and the same opportunity as a supervisor to not necessarily be the best supervisor on day one, right? But to think about, how do I scaffold this? How do I focus on certain pieces of this? The same way I help my students and supervisees to break things down into smaller goals to achieve. And then how do we get there as supervisors? Okay, so to kickstart this process, what Krista and I are going to ask you to do is a reflection activity. So the in-person folks, you're going to break into in-person groups, and our Zoom attendees, Tyler is going to put you into breakout rooms. And we'd like you to take just a few minutes and initially kind of do some individual reflection to think through these 4 questions. And again, we have a handout that may help facilitate this in terms of listing all the different tenets and goals, and think, what parts of the REMS are you already doing? Where do you feel the most comfortable? What parts will be new or different? And then what parts would you like additional trainings to emphasize? And this could be a great piece of feedback for Penny and the UW leadership team in thinking about how are they prioritizing what you need in your supervisor development so they can tailor their training. Again, layers and layers and layers, right? So with that, Tyler, if we could put the online folks into a breakout room for about, let's say 13 minutes. So you're not going to get a lot of time, but we do want some time to come back and debrief this as a larger group.
Hello, my name is Cheyenne Dewey. I am one of the organizers of this workshop. To fulfill NSGC requirements for this asynchronous learning environment, I will be presenting group discussion themes from the live workshop in December of 2022. For those who attended the workshop live, Krista and Ian prompted the following questions with a table outlining the tenets and goals from the Reciprocal Engagement Model of Supervision, or REMS. The REMS summary figure is provided here, adapted from Worley et al. In 2015. Please pause your video and take a few minutes to reflect on these questions. The video will now continue silently for 10 seconds to allow you to pause the video and reflect. Click play to resume the video after your reflection. All right, welcome back from your reflection time. During the live section, we collected the following recurrent themes and discussions when small groups met after their self-reflection time. Regarding prior comfortability with the REMS model and processes, many supervisors noted that Tenet 1, learning and applying genetic information, feels very comfortable because focusing on key genetic information is something they do both with patients and students. However, some supervisors find it challenging to balance keeping a relaxed vibe with students and being a strong teacher. Tenet 5's Students' Emotions Matter was a less familiar piece of the model, some from their own experience as supervisors and also from recalls of their supervisors when they were students under supervision. Several noted they would like to explore in future trainings how to help students dig deeper into their own emotional reactions to certain cases and rotations. Tenet 2, focusing on the relationship between student and supervisor, inspired reflective conversation amongst supervisors learning from one another. Many supervisors commented on their practice of specifically contracting with students at the beginning of a rotation to build their relationship. Part of this contracting may include asking the students about how they prefer to receive feedback. An individual proposed asking the student what has been successful for them in the past when it comes to learning new skills. It was noted that contracting should be revisited throughout the rotation, as the student's progress and the supervisor-student relationship may change over time. Folks also recognize the limitations of time in establishing the student and supervisor bond. This is especially challenging in shorter 5-week rotations. More conversation focused on Tenet 3 around supporting student autonomy, empowering and encouraging them as they progress. Some ideas that arose were giving positive feedback such as, I saw you do A, I think you're ready for B. Reminding students that the supervisor is there as backup if they miss a point or answer a question incorrectly. Supervisors recognized it is challenging to encourage autonomy and let students do things their own way. It would be simpler to train the student to have the exact style as their supervisor. In these reflections, supervisors realized their supervision practice has been informed by memories of their own training and what was helpful or not, particularly from the student-supervisor relationship perspective. Many of these experiences were negative or really did not support the relationship. There was interest in additional training on exploring students' emotions, experiences, and culturally engaged supervision as well. We will now return to the recording of the live event so you can hear the larger group discussion and remainder of the presentation.
As if on cue, I was like, where are all the breakout rooms? And then faces are coming up. Welcome back, everybody. Penny, I want to take some time to debrief this. So I think, Penny, you are in person. So I'm wondering if you can help us be the spokesperson for kind of the in-person or make sure we can capture that. What I'd like to do is take 5 minutes, 7 minutes or so to debrief some of these questions. And for folks that are online working on the hybrid aspect of this, if, as I'm walking through pieces of these questions, if you don't mind putting things into the chat room, that would be lovely. And for in-person, Penny, I'll have you kind of be our Vanna, if you will, to help. I'm not sure how much I can hear from the large group. I'm hoping that this was helpful for you in two ways. One, seeing that, oh wow, like echoing. In one, seeing that you're doing parts of this already, but then also recognizing sort of supervision as a professional development long-term process. So how can University of Washington, how can we help in continuing to grow your supervision skills? So I'm going to start with these first two questions and kind of mold them or meld them together. You know, what did you notice in the REMS that you're already doing and maybe feeling comfortable with? So going to ask for maybe one or two folks from the in-person, and like I said, the chat room, the chat, if folks can put their ideas in the chat, and I'll go ahead and read those out loud for the in-person groups. So with that, what are you already doing? And I know we have some skilled supervisors in the room, so I know that these goals are sort of already present in your work.
One thing our table was talking about was contracting with students at the beginning of the rotation, and discussing things like backgrounds and expectations and where the student feels that they are on kind of that self-confidence interval and what kind of support they think they need from a supervisor.
Excellent. So really, like we do with our clients and patients, setting that agenda, doing a lot of expectation setting. But then I hear a lot of sort of real comfortable and appropriate, and we'll talk about in culturally engaged supervision, assessing students and what their backgrounds are and what they're coming to you from. So you're not kind of starting in a place that they're not ready for, or vice versa, starting in a place that they've already feel like isn't a focus or a training goal for them. Abby added in making sure students are comfortable sharing their concerns and emotions to their comfort level. So I'm assuming sort of in that is making sure that they're not sharing things that they don't want to share as well. And I think, thanks for that, Abby. I think that really contributes to laying and building that foundational relationship with the student. And we'll talk a bit about how that really is so important in terms of this cultural engaged work. How about one more from the in-person group in terms of things that you're already doing or feeling comfortable with?
Lauren, I don't know what anybody can see.
Thanks,
in our group, we talked a little bit about some of the ways that we're trying to support student autonomy and thinking about how we have that reaction as supervisors of like, oh, I want to jump in and fix it. It's not perfect. And, you know, what do we do to make ourselves more comfortable so that we can allow students that space to try?
Wonderful. So there's not only that entrustment piece that Ian talked about, but there's also sort of an internal entrustment that you have to sort of manage in your own anxiety of like, how is this going to go? And not jumping in too soon, because a student might really learn or actually exceed sort of our expectations in terms of what they're doing in that session. How about moving to this next piece in terms of new or different? And I'll probably loop this in as we start to anticipate what are some additional trainings that can be emphasized as you continue in these sort of training workshops. Other thoughts there I'll take from the in-person as well as in chat. Wonderful. I appreciate sort of that acknowledgement of emotions. And Bree also in the chat talked about also how this is particularly challenging in sort of a hybrid model too. And so I love the example of asking about past successes. And, you know, you can begin to sort of use that as an entry point, even to talk about emotions in terms of like, how was that for you? I imagine the feelings are really positive. It's building confidence. So introducing some of that language in a opportunity-based positive way, because then it can also say, are there other times where those emotions weren't present? And how can I support you in those times too? So entering gently into this territory, because I think you're right. Students need to trust us as supervisors to be able to share those, but maybe we can capitalize on strengths and use that as a safer and kind of more gentle entry point. I'll quickly read what also came up in the chat from Emily, is sort of talking about how it was similar to how we are trained to go through GC cases and training. Supervisors, excuse me, could talk through examples of supervisees cases highlighting common challenges. Wonderful. So again, using sort of concrete examples as entry points to begin to talk about these different emotions as well as educational pieces that come up in cases. I am positive that there was probably a lot more discussed in the groups. In light of time, I'm going to kind of move to this cultural piece. If there are notes, especially as you are looking at training needs, I am guessing the program would welcome that. So please feel free to continue to put those things in the chat and they can download them from there or pass on feedback. As Ian shared, I'm going to start to talk a little bit about culturally engaged practice. And this is a whole way in which I really admire how the UW program has taken steps and initiatives here. What we want to do is continue to set the table in combining what Ian has talked about in terms of the REMS and how practicing according to that model of supervision is actually one way we can support and participate in culturally engaged practice. So again, true to form, here's our definition of what this means. And I know there's a lot of different terms that we have heard in different genetic counseling trainings around culturally engaged supervision. We've heard culturally competent supervision. We're sort of moving away from that term because competence implies that there's sort of a linear progression here, and we are always learning in this work. Culturally responsive supervision is another lovely word that we've heard out there. But I think sometimes culturally responsive implies sort of this unidirectional, we are responding rather than sort of engaging. And that's the definition that Ian and I like to work from. This is adapted from the mental health literature because we have not defined this yet in our supervision literature. But what this entails is responses on the behalf of the supervisors that not only acknowledge the fact that culture is in the room, and we'll talk about all the ways that culture is in the room, you are going to show interest in. And so beginning to ask and demonstrating knowledge and some skills in sort of understanding how that culture does impact supervision and the supervisory relationship. And then again, from a real strength-based perspective, expressing appreciation for the supervisee's ethnicity and culture. So this is an additive thing. Culture adds into the beauty of the supervision relationship, as well as the way in which students are working with their patients and clients. So it's really putting this all into a cultural context. Now, we do want to, in this next slide, I think, give a nod to the fact that sometimes when we talk about culture, in fact, I've done some focus groups a while back with supervisors around culture, and I heard supervisors, now again, this was a different time, so I'm hoping that things have changed, talk about, well, we're kind of a homogenous group, so there's not a lot of cultural differences between supervisors and supervisees. But then you look at this framework here, and I undoubtedly cannot argue against that idea that there aren't cultural similarities and differences in the room with your supervisee. So the addressing framework is actually proposed by Pamela Hayes. There's a whole book. Genetic counselors will love this because addressing is an acronym. And so it really stands for all these different aspects of culture. So think and look through this list and think about the supervisee sitting before you, and there are many differences that and similarities that might be present in that room. I certainly, as a spicier seasoned genetic counselor, see that my age is very different than my students and supervisees sitting before me. Are there different disabilities or abilities, whether they're developmental or disabilities acquired later in life? What are religious and spiritual orientations, ethnic and racial identities? Socioeconomic status is one that I think we are really starting to see as sort of different approaches and different lenses that our students are bringing to our supervision work. Sexual orientation, indigenous heritage and national origin, as well as gender. This is a starting list. I certainly recognize that there are many more, but I present Pamela Hayes's framework to you to begin to think about, okay, well, if there are all these different aspects of cultures that not only we bring as supervisors, but then our supervisees bring, imagine sort of all the intersecting identities that are in the room. So here we go again, the REMS. So as Ian pointed out, right, one of the goals, only one of the goals explicitly argues for culture as part of this, or explicitly names culture in here. But I really want to talk about, and this came out even in what you were talking about being comfortable with and already doing, is that the relationship is really central to the REMS, which, as you can imagine, if we don't acknowledge and bring together both what we bring in terms of intersecting identities and positionality, as well as what our supervisees bring, that central aspect of the REMS is going to be lost. And from there, how do we accomplish some of the other goals and support these tenets of the REMS? In some ways, I've seen argued, and I fully, wholeheartedly agree that all supervision is then multicultural, meaning that all these things are present in the room. So all these different aspects, the 5 tenets, as well as those goals, are going to involve cultural aspects. And so we want to just quickly talk about how these are present in these tenets, and then sort of how do we engage. Keep in mind, as you look through these are things that you're doing. But what I want you to do is take on a cultural lens and thinking about how these then contribute to how we can engage culturally with our supervisees. I'm going to actually start in the middle here with tenet 2. Again, building relationships. How do students trust us? This working alliance or working relationship is foundational and really hinges on open and honest communication. Ian and I have done some workshops where we talk about communication as the starting point for culturally engaged supervision. And then we can move into all these other aspects and strategies that we do in our supervision work, but how would it look different? And I'm just going to pull one of these out by example. When we talk about in tenet 1, modifying teaching based on developmental level. Not only developmental level, but also what other cultures and lenses that our students and supervisees are bringing based on their identities. In tenet 3, how do we share culture? Again, the comfort and the trust has to be there. So we're assuming that relationship has been built in a trustworthy way. But, you know, what do I bring to the table in terms of my different cultural lenses and interpretations of cases? What did the student bring? And then how does that impact the level of working with patients and clients? Next slide, Ian.
Just quickly,
yeah.
This idea of cultural sharing is really important to us. So in your handouts, there is a addressing worksheet that asks you to kind of think about your identities in a number of these different dimensions, and thinking about, you know, how does that impact your supervision practice, this identity, and then which of these would you expect to share with students, and which of these would you expect students to share with you? Just to kind of zoom in a little bit on that one aspect.
Thanks, Ian. I'd forgotten that was in the handout. So that's where that comes from, and hopefully is helpful to you. Last couple tenets, right? And, you know, these really focus on, and I was really impressed with folks that mentioned, like, sometimes these are implied, but we are really hoping to make them more explicit in terms of how you are acknowledging these different aspects of students' capability as well as their emotions. And where does that come from in terms of cultural similarities and differences in the room, especially, and I'll point out in that last tenet, because there's a power differential in the room. And especially if you are somebody who comes from more dominant identities, that power differential really expands in terms of understanding where students who come from more marginalized backgrounds, how are they going to be able to share those emotions with you in a safe and entrusting way, especially given that evaluative piece of supervision and the power differential that is already present. So some ways that you are already working through these strategies are utilizing these strategies, but how can you do it in a culturally engaged way and think about culture sort of laying the foundation? I know that UW is really working on diversity, equity, inclusion, and belonging efforts. And so I hope that this is just kind of setting the table as to future training and future ways that we can look at that DEIJ or DEIB work in moving forward. So I'm going to wrap us up here. You should know that my office is like 1,000 degrees and going this fast. I feel like I'm like sweating and running a marathon here. So in summary, I hope that we have given you a framework that is familiar, because I do know that supervisors do this work. And I think often supervision and genetic counseling is like retrofitting, right? Like we're putting names and labels to things that we are already doing. And the REMS does that, provides a guide for you, both in celebrating the skills that you are already possess, and as well as giving you a roadmap for the skills you hope to develop. And again, we wanted to put in this piece around culturally engaged supervision because I think it is fundamental to working through the goals of the REMS, and also I think is fundamental and important given where genetic counseling in the profession is moving. With that, and Penny, I'm sorry we stole some of your time. I do want to see if there's questions, or certainly in light of time, our email and contact information is there. We welcome feedback on how this was for you, as well as any additional questions that we can help in supporting your supervision development as well. Ian, anything you want to add?
No, thanks for the opportunity.
Yeah, thank you so much.
Thank you. That was fabulous. So
Thanks.
Really appreciate that you took the time again on a Saturday to do that for our program. So thank you. Thank you. I think there's a lot of talking points that can come out of that too. And also set the stage for me to talk a little bit more about some of those tenets as well. So thank you. And yeah, don't worry about time. They get a bit of a break anyway. And we were having a little bit of trouble with the tech stuff, which it was bound to happen.
Can I make one comment, Penny, just about the conversation you were having before we jumped in about logbook cases and lab? Just if it's helpful, I was on the ACGC board when we wrote these standards, and actually we didn't include lab cases in the logbook because standard B4.1 requires that students get supplemental fieldwork activities. And that's where the lab cases come in. So if lab cases didn't count in that supplemental, you'd be having to stretch and really reach for how to get to that component. And so that was the reason we separated them. And just as another note for a new program, while ACGC doesn't currently require the programs to submit the numbers for supplemental cases, they could at any time, and they can audit those during accreditation visits. So you really want students logging those supplemental cases just as much as they're logging the fieldbook cases.
Thank you. That's super helpful, actually. And so we can discuss more as the program leadership, but I'm really glad for especially some of the lab GCs to be hearing that. So we can discuss amongst ourselves on how they'll be. And it is in the logbook template that I've set up for the students. Also, as I saw a chat about the standardized patient, that is a category as well. So I do have these categories set up for the students to be entering those. So I think we just need to be better about really stressing how important that is to the students as well, and for the especially the lab supervisors to know that that is a part of the expectations, that they'll have to be signing off on things. So thank you.
Yeah, it's not just lab that counts for those, but a lot of students get that requirement met through lab. Just wanted to throw that out there as someone who was in the room for a little bit of explanation behind the black box.
Yeah, I appreciate that expertise that you bring into that. So yeah,
I'll quickly plug in too. We have had students who have pursued laboratory positions straight through after graduation use their logbook supplemental cases, obviously de-identified and such, but really have found that helpful in job interviews. And so that has been my way of telling students, keep track of all these cases because you will use them in terms of demonstrating skills as well as depth and breadth of knowledge, especially in laboratory spaces. It's been really helpful.
Hi, so I'm Brad, for those of you on Zoom who I haven't had a chance to see yet today. I have a question for Ian and Krista. So thank you for the presentation and thinking about culturally engaged supervision. I'm curious, for those of us who are working with students for the first time, it's our first time meeting the student. I imagine that one of the things that facilitates that is having that contracting where we share our identities, right? So what tips do you have for supervisors in that position where they haven't interacted with students before and they're wanting to start that dialogue and really set the expectation for how we can work together and respect everyone's identities?
That's a great question. I'll go and then Ian goes. And then also, I mean, I don't know if we provided the communication style worksheet, Ian, but that might be something we can provide and follow up to that question. One is, I think, as you start to get to know students, one is just the self-awareness piece. So we have our students working through a very similar worksheet to talk about what they would share and what they would not share with their supervisors and when they would share and how they would share. And similarly as supervisors, I think that's really important because just like with self-disclosure, being caught in the moment of that is sometimes challenging. So some of that pre-work I think is critical. The other piece too is I've heard students really respond well to questions of like things that I should know about you, right? In terms of important pieces of your background and experiences, right? Which is a very general and broad way for students to feel open. And then I think with that culture sharing, we as supervisors, I think the expectation is always for us to take the lead. And that's a bias I have. And so you need to feel comfortable with that. But given that power differential, I think we start to lead. For example, when I was working with supervisees, I would often share a bit about sort of my professional as well as personal background. I am Asian appearing, but I am adopted. And so folks will make assumptions easily about me in terms of my cultural knowledge, which is more about lefse than it is about kimchi. And so I feel very comfortable sharing that. And so would take the lead and say, is there anything that I should know about sort of your identities that would help me in working with you as a supervisor? I want you to know this as a supervisee working with me. So those are just a couple entry points. And then this is just like contracting. You keep doing it throughout the process, right? But starting and providing the open door to that, I think is a nice first step. Ian?
I did put in the chat for the Zoom folks a link. We have a communication style worksheet, which I think is another nice entry point where you can talk about the way that you tend to communicate. Like, are you an internal or external processor? Are you high or low context? Right. And a lot of these things are highly influenced by cultural backgrounds. So it can be a kind of a side entry into some of these conversations that's a little safer for students to engage with. And then just to kind of to underline what Krista said, where providing opportunities and continuing to open a door for conversations, but waiting for students to be ready to go through it. You know, not dragging identities out of them in that first meeting when you know, my big thing, and I stole this from a New England Journal of Medicine essay that I don't remember who wrote it, but trustworthiness before trust, right? And so demonstrating that here's how I'm incorporating culture and identity into the way I practice so that students can see, why are you asking, right? This isn't just like voyeurism, right? Like I want to check my boxes and say I had diverse supervisees this year, right? But being able to say, this is how my identities shape how I interact with patients and how it may shape how I interact with you. And so can we talk about ways to again, then to become, how do we meet in the middle and compromise and find a place that's comfortable for both of us, or as comfortable for both as we can, as opposed to this is how I shall communicate and you shall adapt to me. And I think if you set the table that way, it's a different conversation than So tell me what I need to know about your identity so I don't screw up as a white guy, right?
I just thought I would hop in since I did my capstone project with Krista several years ago, kind of on this area. We're building relationships. So I think for some people, maybe having that more organized structure of now we start contracting, then we build our relationship kind of in a more linear path, I think makes sense. But I think from the research that I had done in interviewing some practicing GCs as supervisors, they found that it was a really organic conversation, maybe over lunch to talk about like, oh, you know, like just food culture or different things like that. So I think for some people, it can be a lot more informal rather than a formal set part of your beginning of your rotation as well. So everyone's got their own way of doing it, and just thought I would throw that out there.
Shameless plug for Cheyenne's paper, if anybody wants to read how race and ethnicity enters into the supervision relationship. I can quickly respond to Sharice's question. So we talk, my poor students, I teach the second year genetic counseling, counseling skills class, and it's actually all built around the reciprocal engagement model of practice in terms of talking about the skills supporting the goals of the REM. And then we also talk a bit about supervision as part of that class, and then build in the REMS as well. So students are, I want to say, grateful for the familiarity with the REM and the REMS, to then talk about, okay, well, how is this, you're in your fieldwork training right now. Do you see this happening? Do you not see this happening? How does that inform how you want to practice as a supervisor? And then how does it also inform how I can support you as the fieldwork director as well?
I also introduce it in our professional development seminar the semester they go into, before they go into the field. So we talk about it as kind of expectations for supervisors and how to get the most out of supervision.
Mm-hmm. We're big believers. No t-shirts yet, though. Maybe.
Next year, goals, right?
Only a certain place I can wear that t-shirt. I would appreciate it, though.
All right, we do recognize that you've got lots of other
Yeah.
ground to cover. So thank you for all the questions, and please follow up with us afterwards if there's more things. I want to make sure Penny's got a great talk lined up for you. I don't want you to miss it.
Absolutely.
Thank you so much. Really appreciate you both. Thank you. All right, so I can keep my video on for a little weird up there though. So we'll take a short break. Let's do 5 minutes, do a stretch, for the ones here, you can grab some more snacks and that at home, get a beverage and stuff. But yeah, so let's take a 5-minute break. Right now I have on here 10:18, so I'll set a 5-minute timer, and then I'll go into mine, which builds off of a bit more of what they were talking about. So, all right, thanks. Okay, so I'm really appreciative of Ian and Krista going into that about the REMS and touching a little bit on the supervisor competencies. So I'll be going in a little bit more. I'm going to focus on a couple. So there may be some things, that we're definitely overlapping on, but I think that just shows where the important pieces are and how very connected all the tenets are, as well as to the supervisor competencies. So start off. So a little about me, I know a lot of you know me already, but just to make sure that everyone does. So I am the director of fieldwork education. So I'm the one that oversees everything to do with our rotations. I got my degree at Cal State Northridge. I joined the GCGP almost 2 years ago. And I had worked as a pediatric GC at Seattle Children's for 17 years and just left my position in August so that I can try to focus more on this. And while I was at Seattle Children's, I had created the internship program in 2009. So that was the first time we ever took a student at Seattle Children's. And then I was the one who coordinated the GC internships for over 10 years. And through that, I directly supervised over 20 students. So that's where my passion is in working with the students. And so I do have the experience of having worked with many students, some of whom are actually on these in person or on Zoom, which is really cool to be able to think that you're actually training your colleagues. And so I hope that you're really feeling that too when you are with the students, that these are very soon to be your colleagues. So it's the best part. So the learning objectives for my part of this talk, let me make sure I keep on time. So let me make sure I have my clock next to me. So I'll be mindful of everyone and their time. So we're going to focus a little bit more with that piece where the facilitating the relationship building. I know they kept going back to as a central tenet. It is. So as what we're really focusing as part of at least this workshop on building that relationship. And then examining how the stage self-directed learning model. So that is something that's outside of joint counseling, but how that applies to the joint counseling fieldwork supervisions. So there's that tenet again, and the little triangle there and those tenets. So I am going to focus specifically on the relationship one. So tenet 2 and tenet 4, that the students are capable. And so going in with this too, with the supervisor competencies, that they are interconnected in many ways. And so for the supervisor competencies, which I've put, you make sure that Tyler gets it to all of you on Zoom as well. But I have put on the tables the appendix B from the article itself. So Tyler, if you're able to email the article, not my notes, just the supervisor competency one, and the other thing, the chart that showed the other piece. So everything but my notes of those things I had you print off. So okay, so those should be coming to you on Zoom via email so that you can see those. It'll be a part of the small group discussions that you'll have those as resources. But there are the 6 competency domains, and I'm going to focus on 2 which are connected to the 2 tenets I'll focus on. So the relationship building and maintenance, and then the student-centered supervision. Okay, so make sure we have that definition. I know that it was brought up with Krista and Ian's, but the Supervisory Working Alliance, the SWA, is the relationship between the supervisor and the supervisee that fosters the training of the supervisee, utilizing the developed skills and knowledge of the supervisor. So it is that development of the SWA that is the second tenet. So that relationship is integral to the joint counseling supervision. And another definition I just want to make sure that we're aware of is the self-efficacy. So that is the perception of one's own capabilities of performing a certain action in a given situation. So self-efficacy is not the same as skill level. Greater self-efficacy does not necessarily indicate competence in a task. It's referring more to about the confidence. And when trainees have good self-efficacy, it can empower them to successfully complete tasks and show advancement in task performance. So there have been some studies that have been focused on the self-efficacy and that working alliance, and not as much with the joint counseling literature and our field, but with other fields. And so in general, what has been found that a trainee's level of training and the amount of clinical experience were significantly related to the student's self-efficacy. There is at least one GC study that did get to focus on this a little bit more. And it showed that the way a trainee perceived their relationship with the supervisor is related to the way the trainee perceives their ability to perform the clinical competencies during their fieldwork training. Of note with the study, it was especially when they only had one supervisor, and the study did make the comment that there were limitations, and so the limitation of the design study was what likely led to that conclusion. But I do think is one thing for us to kind of keep in mind, that the idea that having fewer supervisors overall and having that relationship can make a difference. I know we talk about that. I can understand why they would try to maybe spread out as many supervisors as they can. Sometimes it's going to take the burden off, but I do think that it also becomes burdensome with the supervisor in that they don't get to know the student as well as and building that relationship too. So I think that's something, especially for the larger centers that have a lot of GCs, and really trying to think through what does that supervisory team look like so that is most successful and satisfying for both the student and the supervisors. And let's see. Okay, so we're going to pop on to the tenets then. So how do the supervisors build a strong professional relationship? They already kind of talked about it a little bit, you discussed it, but we'll think about it more here. But how do we build a strong professional relationship with the GC students to help strengthen their confidence in their fieldwork training? So if we're looking back at the tenet 2 and the super competencies under domain 2, relationship building and maintenance. So these are the categories. I will note, I know there's a strong need for us to talk about this, and I have it's definitely high on my list of future supervisor training as with conflict resolution. We won't be discussing that now, but I know that is something that can be challenging in relationships. And so that is definitely one of the supervisor competencies in general, and something I think we can address at some point. So unfortunately, that's not one we will talk about today because there's a lot you can talk about that. And really, if you think about all the supervisor competencies and these REMS, there's just so much that we do as supervisors. So there'll be more training topics, and we want to hear from you what the ones that are the most important to you as well, so that we can try to focus training sessions, whether they be workshops or other types of ways to you all. But for the skills that we can use in order to build the relationships, one thing I want to make sure I address, because it does tie into conversations I've had with some of the supervisors already. So it's the idea of novice supervisor versus the advanced supervisor. And it's not about the novice GC versus the advanced GC, because they're actually very, GCs have been in practice for quite a while, but they've never had a student before. And I do hear about them saying, they're nervous about what it's like to have a student, just so much going into that. And so what I say to that is, really tapping into your GC skill set. And I was hearing Krista and Ian talk about that too, but I hope that it can really build confidence. And it seems sometimes like a daunting task, taking on as a student, but if you really think about it, it's with that building of the relationship, you're using the skill sets that you already are using with your patients and the clients. We do so much as GCs. We've already developed all these skills. And so we're all pretty awesome. So this is what we get to pass on to our students. And so this by no means is everything within this list, but we're building rapport, the empathy, our psychosocial skills, the use of effective communication, contracting, goal setting, facilitating decision-making, empowering them. So you've got this. I believe in all of you with this. I know that it can seem like a lot, but we're here to support you as well. And I think it is just a matter that you just believe in yourself, and everything you're already doing with your patients and your clients can actually be pretty transferable when you're working with your students. So let's see. So thinking about that in terms of okay, building rapport. That can actually be into this with the supervisor competencies of the facilitative characteristics. What is the attitude that you're bringing right from the very beginning with your student? And so what the supervisor competencies say is that Gen counselor supervisors are encouraging, motivating, respectful, and they are empathetic, genuine, concrete, and immediate. So those are characteristics that we really should be bringing into when we are working with our students, and how that can help build that relationship right from the beginning. And then you get into contracting, goal setting. So having that first orientation, and I had heard some of talking about doing that already, having that pre-clinic orientation is really crucial. That is really where it sets the stage for expectations and establishing the students' goals. The student should be coming to you with goals already, but sometimes you need to modify those that they're going to fit to your site more specifically. So really having that set up in the beginning, also the expectations, it's just so key when we're doing that. And asking them questions, finding out where they're at with their skills, where they're with their self-efficacy at that point, what it was like at their previous rotation, how you can help continue to build that confidence, or if they had maybe a tough rotation, how you can help bring him back up too. So, and then establishing expectations is to increase the openness and approachability as well. So being able to set those at the beginning, that they know who to come to, and building that trust already. We were mentioning that. And some of the sites, I don't know if everyone has done this, but I know some of the sites I've talked to have actually had a written document that it really has this laid out. And I really encourage everyone to do that. Yeah, if you're just like one supervisor at your site, I think that can really be helpful too. You can modify it, you can reuse it. It's just going to be helpful to kind of continue to add to that, and as you learn what works in that. And then to maintain that relationship, it's keep the communication open. Communication is so key on this. And really using those empathy skills again, finding how the student's doing. I hear of some students that maybe aren't as open about it. And so really kind of tapping into like the idea of, no, are they really genuinely telling me how they're feeling and things? And so, yeah, it's that open communication is going to be really key, and just constantly checking in with them and providing that feedback, but also letting them know that you want the feedback as well. All right. Okay, so as I was reading through all the competencies and the suggestions, they do bring up the idea of self-reflection, and for the supervisor, self-reflection to increase the supervisor's self-awareness. We're already encouraging it with our students, so of course we could do it. So I'm going to have you all do a little bit of self-reflection time anyway too. So we'll take, let's see, where are we at with time? Let's take about 3 minutes. So if you can just think about some self-reflection, if you want to take some notes on some of these things and you're thinking about the supervisory working relationship. And I will say with the self-reflection, I can't be alone in this, where you do get very self-critical, that when you're sometimes doing that self-reflection, it tends to probably be more around the times when things didn't quite go right. And those negative times that you're like, what did I do wrong? But I would really encourage you to, anytime you're finish off rotation that actually do go well too, is really to think about like, what was the success? Like what led to that? What did I actually do right on that? And because you're going to learn from that as well. And that's where you're going to continue things. And so we'll start with that when you're thinking about the SWAs you've already been having with some of the students. And if you haven't had a student with you, think about your relationships you had with maybe your supervisors. And if that was a while ago, and that's hard to think about too, and you don't quite fit in these, just any professional relationship that you've had. Maybe you've been training some colleagues in that, but think about the ones where they really worked out. And what were the tools that you used or things discussed that helped lead to that positive relationship? Or things that you adopted or that have carried over, maybe you've taken from others? And why do you feel those were successful? And then, of course, though not so positive ones, what do you think the breakdown was? And then after having heard from Kristen, Ian, and then also just thinking a little bit more about it now, are there things that you're already considering about changing in what you're doing? And we won't necessarily share right now. I just want self-reflection. But when we do, I'll shift gears a tiny bit, and then we'll do a breakout group, and then maybe these will come up and you kind of talk amongst each other about that. Okay, I think I'll stop there unless you can keep finishing up your thing you're writing if you need to. But so what I want to do now is, I know we just talked about the relationship building, but I'm going to shift slightly to, there we go. Slightly to tenet 4, where the students are capable, and yes, they are. And I've known that in the past, but I have to say, working with the students now, and like I mentioned about the spring rotations, and they were just ready to jump into things. I'm like, they're so very capable of things. So I love the idea of this tenet overall. And then what goes along with this tenet are the supervisor competencies, domain number 2, which is the relationship building maintenance, but the category 3 specifically, so the supervision dynamics. And then domain 4, student-centered supervision. And you have the list of them, so you can take a look at what those are. I'm not going to write them out here. But looking at tenet 4, the idea of recognize student stage of development, tailor the supervision to student skill level, and foster student confidence. So when in reading this, it made me think of an article that was provided to me, and I had taken this certificate program, and it was an article that was provided, and it was titled The Teaching Learners to Be Self-Directed, and it is in this Adult Education Quarterly, so it is about the adult learner. And so as adult learners, that we are learning to be self-directed in the tasks that we do. And so as part of this article, they focus on the STAGE self-directed learning model, which is the SSDL. And the whole premise behind it is that learners advance through stages of increasing self-direction, and that teachers can help or hinder that development. And that the good teaching matches the learner's stage of self-direction and helps the learner advance towards greater self-direction. And I think the big piece on that too, though, that is focusing on the teaching. And as supervisors, it ends up being our responsibility to be changing where we're at with our stage of teaching that's going to better match the student and where they're at with their stage, and really trying to encourage them, building that confidence that they are going to be advancing towards that greater self-direction. So the SSDL model is in 4 stages. And so you can see that the stages progress up, and starting out with the learners of low self-direction, going to moderate, intermediate, and high. And so at each of these levels, you have the dependent student, interested student, involved, self-directed, and then the one that matches up with them, authority coach of a teacher, motivator, guide, facilitator, or consultant delegator. And that's the other thing that I provided, was the list of those, which I'll go through here so you can refer back to them when you're with your small group discussions. So focusing on stage 1. And so going back to the idea of the novice, student, the novice learner, going up to more of the advanced learner. Although I want to pause here, and going back to the idea of the novice supervisor, advanced supervisor, I think in some ways you can almost see yourself in the development as you're going along this, and as you're building those skills, and how you're becoming, and that self-directed learning as you are becoming a more advanced supervisor in itself. So just kind of a side note, but not what we're really focusing on, but I think it's something you can think about as you're thinking about your own skills and development. So back to this with our students and that we're working with. And so I'm going to refer to them as the students, supervisors as teachers, just to be consistent with what it is in the article. But for the low self-direction learner, these are the dependent learners, and so they need more authority, someone who's really telling them what to do, how to do it. It's the teaching tends to be more or the learning tends to be more teacher-centered overall, and the student is at a stage of development where they depend on the teacher to make decisions that they themselves will learn to make someday. So it is a time for the authority coach. This is where you're going to have the best match. And when someone is being in an authority coach stage, they are the expert, and they have to establish their authority too, and show their expertise. They need to build that trust with the student for them to believe that they are the expert in that. It's essentially the teacher pouring that knowledge into the student brains, and really preparing them for higher levels of achievement and self-direction. So there is more work on the supervisor's part in general, like what they are giving to the student. But it is, that's the type of matching where it is more focused on the teacher. So then you get into stage 2, which is the moderate self-directed learner. So this is the interested student. They're available, they're interested or can become interested. They respond to motivational techniques. They are willing to do assignments that they can see the purpose of, and they are confident but maybe largely ignorant of this subject of instruction. And I actually want to mention one point before going further, was the SSDL was actually focused more on classroom teaching, but I felt there was enough, when I read it, it was like, this still applies to what we do as supervisors and teachers, and kind of figure out how we work well with our students. So it is more focused on that, but it can be applied in many different ways. So Yeah. So if you're also in the classroom, think about that as well. So the teacher for that best matches up with the interested learner is the motivator or the guide. And this is the teacher that's thought of being the good teacher. It's the one that brings all that enthusiasm, and everyone's just so excited to learn from them. It's the thing at this stage is that you need to be training students like such as goal setting, all those basic skills. And it's you tend to use praise, but you tend to get away from using that praise because you're going from the extrinsic motivation to the intrinsic motivation. So rather than praise, phasing out and phasing in encouragement. Then we go on up to the intermediate self-directed learner. So this is the involved student. These are when the students actually have the skills and knowledge and they are seen as participants in their own education. They want to explore the subject, they can do on their own. They do need some guidance. And in order to develop that the deeper self-concept, more confidence, more sense of direction, and a greater ability to work with others. So those are the pieces that you still need to help them through kind of those more advanced skills to get to that fully self-directed learner. And so that facilitator teacher, their goal is to empower the learners. And this is a time that the teacher is actually most involved in the learning process with that learner. They're sharing the decision-making with them as the students are taking more of that increased role on. And the instructors concentrate on the facilitation and the communication so that it supports the student actually using the skills that they have. Then you get to the highest level of the self-directed learner. So these are the ones that are setting their own goals, their standards. They don't really need help from the experts. They'll probably use the experts more as maybe a consultant if needed. The learners are willing and able to take responsibility for their learning, the direction, the productivity. And in general, these are the learners that actually thrive when they have more autonomy. And so the teacher that matches best with this is going to be a teacher that is not there to teach the subject matter, but to really cultivate the student's ability to learn. And you can see the roles are listed here that the consultant or the delegator can take on. So it might be a delegating task. It might be a role that is more of a mentor. It might be just someone to kind of plant those ideas, questions, and then challenge the learners and then just step back, really enforcing that lifelong learning in them. So as I was going through, I was going to say, these are the ones that are matched up. Well, you have this chart here that actually shows where your teaching style is versus where the learning stage is at. And ideally, you're going to have these matches. So the S1, T1 match up and just nicely do that. And there's some near matches, and those are probably okay. If you need to modify anything or not. You get some mismatches. Those aren't really great. The really concerning ones that can be pretty chaotic are the ones when you get the severe mismatches. And so the one off to the upper left, which would be the authoritative expert and then the self-directed learner, this is a severe mismatch. Sometimes the self-directed learner, they can maybe find their ability to function well and retain the overall control of their learning even under that directive teacher. But others may not. They may see that as resentful. They may rebel or retreat into boredom. And then the teacher may actually see the learner as uncooperative or unprepared to learn the basic facts. And then you have the other severe mismatch at the bottom here. And so with this example, this is when the teacher delegates responsibility that the learner is not equipped to handle. The student may lack the skills such as goal setting, self-evaluation, project management, critical thinking, group participation, learning strategies, information resources, self-esteem. Now, these are all the skills that make a self-directed learning possible. And so the student may be resentful in getting this freedom. They weren't ready for that. And then the student may also think that the teacher really has little interest in them and interest in their learning. Whereas the teacher may think the learner is not taking responsibility for their own learning. So you can see that this can really lead to that conflict then when you have that. And you know, it gets back to then, well, what is good teaching? And, you know, good teaching might not, for one student development may not be good teaching for another student. So I think to really think through kind of where that student is at in that level and what we can do as supervisors, again, it is our responsibility to try to change our style notes to help encourage them to keep moving up with these stages. And also I think keeping in mind though about not moving up stages, it's not always linear. So sometimes there may be some, and also I think too, it's not all about, we're kind of talking about the student as a whole and all their skills and they're moving together. Not always. You may see like they're really good at some things and they're really struggling at other things, and that's okay. And so it's a matter of, okay, let's try to at least build up the one maybe they're not as good at, and that's where it comes with the goal setting. But that also, you may find that a student almost in some ways seems like they regress. Maybe it's because of the subject isn't quite clicking with them as well. Maybe they're becoming just self-doubtful on things. There might be things that are leading to that. And so again, it's not always linear, but at least as you're learning from the student, where they're at with this stage, that trying to work with that. And so how you can help facilitate their growth overall. Make sure I had any other notes on that. No. So getting back then, looking back at that slide and how that can be helpful is, so, you know, the students are capable, and hopefully that SSDL is one way to kind of think through of these and on how to recognize the student stage of development, tailor the supervision to the student skill level, and then fostering the student confidence. So I hope that's a tool that you can kind of incorporate as you're working with the students, especially if you're finding that maybe there's feeling this mismatch. I do think, no, there are style differences in that, but I do wonder too if it tends to be more about the teaching learning stages as well. And if there is a bit more of that mismatch, and that's maybe why it's feeling like, oh, there's it's a style thing. And no, I can totally agree that there's style and there's no personality differences, and get into like cultural, is there clashes with that, maybe not feeling respected. So I think there's other things to go into, but I think this is something also to kind of incorporate into that, figuring out like what did maybe not work out as well with the relationship. So more self-reflection and group time. So I want you all to start talking. So you might take just a minute to think through a couple of these first questions, but I would love for you to start discussing amongst each other some of these. So as I was going through those, did you happen to see yourself as like, that's naturally where I tend to be as a teacher? Was there one that really was like, yep, that seems me? And if it wasn't like that, did you maybe see like, is there a learning level that you're like, oh, those are the best learners that I love to work with? So was there something with that? And then on the other side of that, is there a learning level that you maybe have a harder time teaching at, or the harder time to work with that specific learner? And then what are some strategies that could help modify your natural teaching stage to match that learning stage that you do have more difficulty with? So you can take a little moment about that, and I would think, talk through, because you might find that others in your group actually resonate more with one learning teaching stage that maybe you didn't as much. And so it'll be interesting to hear others and what maybe they're at. And then I think also in your group then is trying to tie together a little bit of everything I was talking about here was, what are strategies that could help you determine what learner stage the student is at? They may not always know. So what are some things that you can do to try to elicit that information? So, and where are we at with time? I want you to be able to have a good amount of time. Let's do 8 minutes of being able to talk with each other.
Hello, my name is Charisse Klotz, and I'm one of the organizers of this workshop. For those who attended the workshop live, Breakout groups were formed and Penny prompted these questions for small group discussion. Below the questions, I have also provided a summary of the different teaching and learning styles she reviewed. This video will now continue silently for 10 seconds to allow you to pause the video and reflect for a few minutes, since you do not have a small group to join. Click play to resume the video after your self-reflection. Welcome back. During the live session, we collected the following recurrent themes from small group discussions. First, several genetic counselors mentioned the motivator role, which is teacher stage 2, is most comfortable for them as supervisors. For some, stage 3, the facilitator role is also comfortable as a supervisor. Many genetic counseling supervisors mentioned they find it most challenging to work with students in the dependent role, which is student stage 1. Interestingly, some newer GCs struggle to work with very advanced or self-directed learners, which is student stage 4, because it can be difficult to know how to provide guidance or answer advanced questions. Due to the preferences just reviewed, it does make sense that a self-directed learner would match poorly with an authority coach supervisor, or a dependent learner would match poorly with a consultant delegator supervisor. This was reflected in the match-mismatch table that Penny referred to during her talk and seemed to be really eye-opening for many of the live attendees. Finally, there was discussion regarding student and supervisor progression through the different stages and distinguishing true progression of student independence from student and supervisor learning or teaching preferences. We will now return to the recording of the live event so you can hear the larger group discussion and remainder of the presentation.
Okay. I hate to like stop conversations, but I love the fact that you all get to chat with each other. Actually, I think we can talk, if kind of like Chris and Ian had done with theirs, is if ones are willing to state what they talked about in their group. Now, what were some things that came out of the discussions? And I would love to just have it as the bigger group overall. And that could be on Zoom. I don't know if we want to do it as chat again. Charisse, if you want to read that, or someone wants to. Okay. Yeah, so anything that anyone wants to do, like.
I'll jump in. This is Nancy from our group. Given that these are graduate students, we all sort of have an expectation that they're beyond stage 1, that they really want to be learning new things. And my ask from the program is, what is the knowledge base they're coming to my rotation in? We're cancer, and if they don't have their cancer until later, what do we have to supplement for them? And so we all seem to have more fun and be more comfortable with, stage 2 and beyond, but there's kind of a sense that you're not going to get in the graduate program if you don't even know what you don't know.
Yeah, no, I think that's a great point. And yeah, when you brought that up about cancer, that's something that's actually specifically cancer on my mind for that 10-week rotation on the spring one. So more to come with that as I kind of think through that. But you're right that I do agree to a point that the stage 2 should be more of where they're at when they are coming to you, but we can't guarantee that overall. And so yeah. And looks like Emily has something she'll come up to.
Hi, this is Emily. We were talking about how in some settings, these are stages where you expect them to progress through them, the trainee to progress. But in some settings, they're just sort of, what's the type of learner that this person is, that they're not necessarily going to progress or need to progress. It's just, what are they approaching this particular task with? We were kind of comparing capstone versus clinical. And again, it's sort of two different ways of looking at it based on the setting and what are your expectations of progression, or just trying to address where they're at.
Just adding to that, I think that's really, really interesting because I was thinking of it, and I think many of the individuals that I was speaking with online in the smaller groups were thinking of it more in that progressive way, that we see students, especially genetic counseling students, come in and wanting to gain more and more independence, at least in the context of these sessions, and taking them on as hoping to really progress to that point where they're independent GCs. But just even their learning styles may be kind of baseline at a different point in terms of what their preferences are. But I think we have to keep in mind too, that because the point is to train them to be doing this job autonomously and independently. Yeah, I'm so like stuck with it in my head now, because I think about it as a progression thing. And that's just a really interesting comment.
Just wanted to say, taking off what Charisse was saying, if people are, I've had students in a place of always wanting to know exactly what it is you want them to do, and kind of get stuck there. That and I don't think that's an okay place to be stuck, to always be the person that says, I can do what you tell me to do, and want the outline and want every test question, and they're going to over prepare for that. So I think we do have to think of it a bit, at least, as a progression, and though that's part of what the classwork is feeding them the information that they need to then incorporate and ultimately do their job. I've had students say, it's easier at the beginning when I just parrot what it is I've heard other people do. But once I understand better more of the information and have more background, it's harder then to try to synthesize that, put it in a way that makes sense to me and will make sense to the patient. So.
Okay, so I'll just do my summary slide here. So thank you so much. I really appreciated the conversations, and hopefully you had a lot more in your small groups. I heard a lot of rumblings and that, so that's good. So just that summary then, the Supervisory Working Alliance is integral to genetic counseling supervision. We heard that from both talks now. The GC skill sets you use with patient clients are the ones that you also use with students. So I hope that's able to bring some confidence in what you are bringing to our students and when you're working with them. Recognize student stage of development and tailor supervisions to student skill level. And then the SSDL model can be helpful in determining which stage of teaching matches with the student stage of self-directed learning. So, and I love my little heart graphic, so I have to use it again. So, all right, well, thank you. Okay, so I think caught up a little on time, but if you want to take a little stretch break, we put out some cookies and chocolates. So if you need a little pick me up that way, sorry Zoom people. Hope you have some chocolate and cookies at home. Yeah, but maybe just a couple minutes as Brad is able to get set up, and we'll pass along to him.
Wonderful. So thank you for bearing with us. Since we are so far behind time and because it's Saturday, and I figured that you probably have other things that you'd like to do with this day, we're going to try and get through some of this pretty quickly. So the framing for today, we're revisiting LGBTQ+ inclusivity. And I wanted to frame this talk both from the perspective of how we work with our patients, right? But also how we work with our students in a supervisor trainee environment as well. So thinking about this broadly, how we can improve our practice both as practitioners and as clinical supervisors. Here's a little bit about me. I'm not terribly interesting, so let's just go on. I have no disclosures. The learning objectives I thought about very carefully. You can read them later, but I want to ground us. So we've raced to this point to slow down. I want to ground us in a principle that we spend a lot of time teaching our students. which is easy to sometimes forget. It's unconditional positive regard. So as genetic counselors, we strive to have this for all the people that we work with, both our patients, but also our clients, our coworkers. We should have this for ourselves. And so I just wanted to ground us in the idea that we are all here. We are all good people who are trying our best, and we are on a journey of self-improvement. And each of us is at a different point in this journey. And so there's room for that. We can support each other on our own individual journeys and learn from each other. And having unconditional positive regard for each other helps us get there. So with that, I just wanted to provide a very brief amount of background information to get us settled into what we're talking about today. So when we think about the queer community, the LGBTQ+ community, what we're really talking about are people who have different identities related to their sexual orientation or their gender identity. And we sort of define these identities around two concepts, right? So sex and gender. Sex is a biological descriptor. We typically assign sex at the birth of a person based on the external genitalia that they have. So most people, that is the only time that we really think about their sex. It's a one-time assignment, and then that stays with them for their whole life. Gender, on the other hand, is an identity. This is a personal process that someone goes through to develop this identity for themselves within the context of the society that they live in. So every society has different gender norms. We have different ideas about what people who are assigned male at birth, what people assigned female at birth are expected to do within society, how they dress, how they act, what sorts of roles they have in society. So all of that factors into a person's development of their own gender identity, whether they choose to accept those cultural norms, whether they accept some but not all, whether they reject them entirely. And that complex process that happens results in a fully formed gender identity. Usually this happens in early childhood, but it can change throughout a person's life. And so when we think about gender identity specifically, we tend to think about this in two broad categories. Cisgender, individuals whose sex assigned at birth corresponds to their gender identity. So they have a male sex assigned at the time of their birth, they adopt a male gender identity. Or we think about the opposite, transgender, where someone's sex assigned at birth does not correspond to the gender identity that they ultimately develop for themselves. So this would be someone whose sex assigned at birth was female, and then later they adopt a different gender identity that is not female. So that may be a male gender identity, it may be a non-binary gender identity, it may be genderqueer or a number of other identities, but not specifically a female gender identity, which would be assumed based on their sex assigned at birth. So we've already talked about gender identity, but once this has been established for someone, the way that they communicate that to the world around them is what we call gender expression. And so there are a lot of really nice visuals that can help us conceptualize this. I like this one from the Transgender Student Education Resource Network. So they have this lovely gender unicorn, and I would encourage you to go back and kind of think about what this means. So they present these ideas as spectrums, and people can be at different points on the spectrum at different points in their lives and move back and forth. Another relevant aspect to remember is gender pronouns. So when someone has a gender identity, that often informs what pronouns they use. So pronouns are how we refer to people in the third person. Most of these are pretty familiar, but there's one that may be different for you. So there's a gender neutral pronoun. Because English doesn't have a singular gender neutral pronoun. We have the they, them pronoun, which traditionally was used as a plural pronoun that was gender neutral. Some people in the trans community use they, them pronouns just to refer to themselves, right? But other people prefer a gender neutral pronoun that is a singular pronoun, and that's ze, here, heres, or sometimes ze, zir, zirs. So gender neutral pronouns. There are a lot of other pronouns that are used as well, and I've got some resources at the end of this presentation that can tell you more about those. So going back to LGBTQ+, I'm going to say queer community for the rest of the presentation, but I wanted to go ahead and define this. Really, we're talking about a group of people who have sexual orientations other than heterosexual. So lesbian, gay, bisexual, pansexual, asexual, are the main ones, and then gender identities. People with different gender identities other than cisgender identities are included in this community. So transgender, queer, non-binary, genderqueer, intersex. And I'll point out that intersex, some people use this as a gender identity. And in the medical community, sometimes we use this term to refer specifically to individuals who are born with ambiguous genitalia or conditions that make it difficult to make a sex assignment at the time of birth. So if you encounter someone who uses this term, it's always a good idea to explore what that means with them, as it may be relevant, if it is relevant, I should say, to your assessment and what care you're providing. So some of you may be saying, are things really that bad? Like, why are we still talking about this? We know that things have gotten better over time. Here are some legal landmarks that have affected the queer community. So in 1986, there was a Supreme Court decision that upheld anti-sodomy laws, criminalizing sex between consenting adults who are engaging in homosexual activity, right? So not that long ago, there were still laws that actively criminalized sex between people who identified as queer. And then in 1996, there was the Defense of Marriage Act, which was a federal piece of legislation that essentially defined marriage in the United States as being between a man and a woman. There were no exceptions to that. And then gradually things have gotten better more recently. So Lawrence versus Texas was the Supreme Court that got overturned all anti-sodomy laws in the United States. California Proposition 8 was a bit of a setback. That was sort of like the Defense of Marriage Act for California, where they were, as a state, defining marriages only being between a man and a woman. So that was a ballot initiative, a proposition that was passed and then later overturned. And then we've had a number of other more recent federal Supreme Court decisions. So the most recent one in 2015, Obergefell versus Hodges, was what really paved the way for gay marriage being legalized in the United States in all states. So some states prior to that had laws that allowed for same-sex marriage, but not all did. And that 2015 decision reversed that and made it such that all states were then required to provide that. If you're following the news, if you followed the news specifically this week, you may have heard that the Senate passed a bill that, unlike the Supreme Court decision that says, yes, same-sex marriage is constitutional in the United States, the legislator said, you know, we actually don't have a federal law that protects that. And so there's fear, especially since the overturning of Roe, that the same legal argument that was used to justify same-sex marriage in the United States could also be overturned in the Supreme Court. And so now many legislators are trying to protect those rights through federal legislation. So the Senate passed a bill this week that would do that, right? It would create federal legislative protection for same-sex marriages and also interracial marriages. So this is a tiny slide. I did a screenshot. This vote passed. There was a majority of senators who voted for this. It was not a mandate. 61, I think, 61 senators voted in favor of this law. This happened on Tuesday this week. 30, how many? 36? It's really small on my screen. 36 senators voted against it. Not a mandate. So there's still work to be done. So yeah, you know, we talked about love wins and discrimination is over, right? We're getting better. But in 2001, we saw an unprecedented amount of legislation from many states in the United States, specifically targeting the queer community, specifically putting into law things that would make their lives more difficult just by virtue of their identity. We know that this is different from state to state. So there are certain states where there are laws that protect the rights of the queer community. There are some states that actively have laws that actively discriminate against people in the queer community. So you can look at this graphic a little bit more. But when we think about this, it's really important to ask who has been left behind in all of the progress that we've made, right? So we've talked about making federal progress on same-sex marriage, but who is not being included, right? Who's not getting to experience the same benefits? And it's the transgender community and the gender, queer, non-binary community that's really disproportionately being targeted now. So not that long ago, the US Supreme Court said that a pageant can exclude transgender women from from competing in their competition. And Americans are really divided on the issue of transgenderism, right? So whether or not this is something that should be supported, whether or not this is something that we should be trying to work against, people really fall into, you know, two big camps, and there's a lot of disagreement about what's best to do. And then there have been a lot of bills, unfortunately, very recently that are targeting trans youth. And these are not only becoming more common in terms of being enacted more frequently, but they are imposing restrictions on someone's ability to transition, which can have very, very devastating effects, not only on someone's psychological well-being, but even on the way that they are treated by their communities. If you have codified into law that somebody's existence is a problem, you are sending a message to your community that it is okay to treat them differently, to not allow them to express themselves as they are. And so the ACLU is tracking legislation against the queer community. There are a number of laws that have been enacted recently, as in earlier this year, that are, you know, rolling back rights that this community has had more recently. So Florida's Don't Say Gay law effectively banned high school students in general, but especially high school students, from talking about their sexual orientation and gender identity at school. It is not, it's sort of like the don't ask, don't tell policy that the US military used to have, where we're not gonna like kick you out necessarily for being gay or trans, but you can't talk about it. In Texas, the governor issued an executive order making it illegal to provide gender affirming care to youth, to trans youth specifically. So no cross-gender hormones, no gender affirming surgeries, nothing that would support someone's ability to transition. And this act criminalized anybody who helps or supports a trans youth in transitioning. So all mandatory reporters, so teachers, medical providers, were obligated to share if they encountered a situation where they learned of an adult helping a trans youth transition. Yeah, and then there's been a lot of debate about trans kids participating in sports. And this is another issue that really divides a lot of people. So anyway, you might say, okay, fine, there are bad things happening in the world, but we as genetic counselors are doing better, right? I'd like to think yes. And I think that we, you know, as a profession do work to make everyone feel included, but we learned from the Exeter report, right, that there certainly is still work within our profession to do. So I pulled some of the themes from this, and the limitation I think with what the Exeter group was able to do was, you know, a lot of these themes came from one session, which was attended by 9 different people, right? 9 different members of our profession who were able to participate in a focus group and share their thoughts and experiences. So, you know, that's not a lot of people to draw on. And even with that, we got a lot of really big things that came out of that, really big themes and important work to do. So for example, more training on queer topics. And you know, how much is enough, right? One talk isn't enough to really become proficient in this and to really know what's best to do. And then we also need to be better about recruiting queer voices for leadership roles, right? And we need to elevate people who hold these identities and give them a position to really affect change and advocate for themselves and their community. And we need to be better about not othering people. It's really easy to slip into this and to slip into it unintentionally, right? But othering people sets them aside and makes them feel like they're not fully included. And then of course, you know, we need resources to support this work, right? We can't just expect people to do this on their own. We need to provide them with resources so that they're able to do this. I'm going to skip over these for time, but these are just some of the quotes pulled from the Exeter report. I'll make the slides available so you can review this later. But yeah, I mean, there's a lot of things that people have encountered that I think we can all agree probably should change. So then the question is, how can we do that? The other thing we might be thinking is, but this is Seattle, right? Like, you know, gay marriage was legal in Washington State before the 2015 Supreme Court decision, right? Like, things are better here. And so the University of Washington rolled out this bias reporting tool, and they've got a year's worth of data, and they made that report available earlier this year. And what I wanted to highlight is that this tool allows people to report incidents that they either experience or that they observe occurring here at UW. So this is both for faculty, staff, providers, patients, and people who are training, right? So students as well. And it can be, you know, bias relating to any number of dimensions of a person, right? So their racial or ethnic identity, their gender identity, their disability status, a number of different things have been included in this, and they have a really thoughtful team that reviews these reports and then tries to find ways to improve it at the university. But what I wanted to highlight was there were, in the first year that this tool was available, 381 reports of bias. We saw that coming from all groups at the university. Some groups were more likely to report being impacted. So specifically, the highest proportion of bias reports came from patients and families, and then staff. And then the group that was highest to, you know, have engaged in this was also staff here at the university, and to some extent probably to faculty. So sometimes that line gets a little bit blurry, but we saw that a number of faculty were also not doing or were sort of perpetuating some of these bias events. And so the report broke down the types of biases that were observed, and you'll see that gender identity was one, sexuality was also one. A lot of different types of things probably went into this, but I wanted to share, and I left my paper over by the thing. So the big one, the big category of these biases that came up were microaggressions, right? So most of the biases that happened were microaggressions. And when we think about microaggressions, what we're talking about are everyday, subtle, intentional, or oftentimes unintentional interactions or behaviors that communicate some sort of bias toward historically marginalized groups. And I want to emphasize here that, you know, oftentimes this is unintentional. I want to remind us that we talked about unconditional positive regard at the beginning of this talk. We are going to do this, right? We're all going to do this. And a lot of this is going to be informed by our background and experiences, things that we've heard growing up that we haven't necessarily stopped to think about, right? We haven't thought about how that message is received when we're communicating it. And so microaggressions are going to happen, and it's really important for us to be able to recognize when they do, and then when they do, to recognize how we can then work in our own way to prevent them from happening again. And so there was a really great project through GLAAD, which is an organization that used to be the gay and lesbian, they were, let's see, activists against defamation. I don't think it was activists, but anyway, they've since rebranded. They've been around for many decades now. They've rebranded. They're now more of an LGBTQ+ media advocacy group. And they had an intern who put together for Transgender Awareness Week a series of microaggression photos. So they encouraged people from the trans community to take photos documenting microaggressions that they had encountered themselves. So I wanted to share some of these with you, because some of them I think we're going to all recognize as being microaggressions. Be like, that feels bad. And others might be things like, ooh, well, I kind of did that once. Or, oh, I don't know that I necessarily would have thought of that as a microaggression. So here's a picture of a trans woman who submitted this phrase that she was told: "You will never be a real woman." So that seems ouchy, right? Like, we can all recognize that this is not okay. That's mean. So, you know, I don't know that I would call that a microaggression. I think I'd probably call that a macroaggression. But anyway, so, you know, this is something that this woman experienced, right? Someone said this to her. Here's another one, a little more subtle. "You are so beautiful for a trans girl." Ouch. I'm just gonna say ouch because that's ouch. Yeah. So this is othering, right? Like, you know, it's not that, oh, you're so beautiful, which, you know, in some contexts may be appropriate to say, depending on the nature of your relationship with someone. But to qualify it as so beautiful for a trans girl, that's really where the microaggression here is happening. And that gets back to that other idea of othering. You need to shave if you're trying to look like a girl. So this individual identifies as agender or queer, and they use they, them pronouns. So they may not be trying to look like a girl, right? They're just trying to live their life. They're just, being who they are. But society has ideas about what they should be. And sometimes people feel the need to reaffirm those social norms and ideas about gender stereotypes, really, right? Like, what is typical gender behavior? So here's one. So this individual provided the microaggression that they experienced in Spanish. So I'll read the translation for you. I can't give you a job. You would confuse people. And then this individual, she is a trans teenager, and someone asked her, did you have the surgery? So she uses she, her pronouns. Her sex assigned at birth was male. So what they're really asking is, have you had surgery on your genitals? Right? That's not something we usually talk to people about, right? And I know that in this room, a lot of us, are like, yeah, these are all really obvious, Brad. But there are more subtle forms of this, right? So asking someone about the changes that they're going to experience during their transition. Are hormones going to change your voice too? So this one to me is like when we start to feel like maybe this is something that is coming from just a place of curiosity. Like maybe you don't know that many trans people, maybe this is the first time you're talking to a trans person and they've shared a little bit about their transition, and you ask a question that's coming from just a genuine place of curiosity, but maybe it doesn't land that way, right? So it's sometimes hard to know, where these lines are if we don't have personal experience to guide us. So before we ask questions like that, we should always think about, like, what is the context in which I'm asking this? Am I asking this of a friend? Like, do I have that kind of relationship where there's trust and understanding and they're going to want to support me as I'm learning more about what it is to be trans? Or is there like some sort of power differential, right? Am I a healthcare provider, or am I a supervisor at work who's asking, these kinds of questions? Wow, I never would have known you used to be a girl. Yeah, definitely an ouch. Yeah, because what does this again make you feel? Or what is this an example of? Oh, okay, I'm sorry. I thought I heard someone from Zoom saying something. So, yeah. So this is, really kind of failing to see somebody as who they are, right? Like you're still sort of anchoring your thinking of this person based on their sex assigned at birth, right? When you transition, you move away from that. Psychologically, you move away from that. You do everything you can to live in a way that feels right to you. So you don't think of yourself in that way anymore. And when other people do, and when they kind of hold you in that space, it can feel really othering, right? Like I'm not fully included as who I am because someone sees me in a different way than I see myself. And then this was the student who organized this this event. And so as a trans man, someone told him once, well, you understand what it's like to be a woman. So again, not great, not great. And then the last one that I wanted to bring up, because this one I think is the subtlest. Cool, you're my first trans friend. So again, going back to othering, yeah, like not seeing them for who they are, but seeing them for what they are, right? And this also kind of takes away their humanity a little bit. It's like, now suddenly it's not about you as a person, but it's about you as like checking a box that, I don't have a lot of experience with, like, oh, you're a novelty. Yeah. So there are other microaggressions that we see in healthcare. I've given you some links here to explore this topic further if you want. And then a study from the University of Georgia found that people in the queer community face microaggressions daily. And, you know, it can be coming from all different aspects of their life, but it has an impact on their physical and their mental health. So these are really important things that we should be aware of and trying to minimize. So I wanted to kind of now very abruptly transition back to what we do, right? What sorts of things can we do in this space as healthcare providers? And so being aware of the psychological issues, the psychosocial issues rather at play with this community can help us better serve them, right? So knowing, first of all, that coming out is a journey. Like, it's not suddenly that you wake up one day and you're like, great, I'm gay. I'm just gonna be gay now and everything's gonna be hunky-dory. It's a process, and it starts with coming out to yourself, reconciling this identity, whatever that identity is, and then progressively sharing that with other people in your life. That decision, who to tell and when to tell them, is a calculation. And I will tell you from personal experience, I still make this calculation. Every time I choose to disclose my identity as a gay man, I am calculating in my head, what is the chance that this is going to go badly? Is this going to take this experience that I'm having right now and make it worse? Or is it going to make it better? Because let's be honest, you can probably read, I'm a little gay, right? But in Texas, I kid you not, if I didn't disclose that I was gay, people would sort of give me this benefit of the doubt that I wasn't. Like, it was sort of that don't ask, don't tell thing. It didn't cause any problems. I didn't ruffle any feathers if I didn't say anything. But the minute I did, then people would have to react, right? They'd have to respond. So even to this day, you know, I still think about, what are the risks that I might be opening myself up to? Am I going to get some lecture about, oh, well, gosh, you know, that just, I don't know that that's really a good way to live, right? Or, oh, yeah, that's great. My so-and-so is also gay. Do you know them? Like, no, I don't, right? The other thing is, you know, we know there are a number of disparities and sources of discrimination for people in this community. We've talked about some of those already in terms of the legislation, but we know that there can be discrimination in the workplace, and there can be discrimination that comes from strangers and a number of other places. In healthcare, we think about certain health disparities as being more common in this population. So higher rates of homelessness, especially within the youth, right? So queer youth have one of the highest homeless rates out of all young people in the country. And a lot of that relates back to when they come out, getting kicked out of their homes. And so, you know, other things that we see in this community as being health disparities are substance abuse. So that can be both drugs and alcohol. Higher rates of mental illness, so depression, anxiety, things of that sort, and higher rates of suicide. And I've given you some links too that you can explore and look at more. So, you know, there's a lot of variability within this community. And I don't think that's a surprise. We see that in all different identities, right? So, you know, someone's identity doesn't tell you a whole lot about them. It tells you some things about them, but it doesn't tell you everything. And so, you know, when I think about my own experience, you know, when I moved to Seattle and was looking for a physician, I wanted a physician who was part of the queer community. I just, you know, I wanted someone who got it, right? And so my primary care provider is a lesbian woman. She's married. You know, I've been seeing her now for, I guess, about 8 years. And it's lovely, right? Like, we just have this shared understanding. And there are a lot of things that I don't have to explain when I go in and see her. If I have a question, I'm like, I know she's going to get it. I know I don't have to be like, here's why I'm asking for this. And also, you know, there are a lot of things that she does differently, I'm sure, for me than she does for her other patients, because she knows where I'm coming from, right? And I felt comfortable sharing those identities with her because I know that I'm less likely to face discrimination from someone who belongs to this community too. So that's one thing as providers that we can do, right? When we communicate that we are open and that we are inclusive and welcoming of people in this community, it can really help us provide better care because our patients are going to trust us, they're going to open up to us, and then they're going to let us in on the things that they're really looking for, and then we'll figure out how we can best meet those needs. Yeah, so I think that was all I was going to say there. So, right. Genetic counseling, how can we improve our practice and support our students? So contracting. mirroring language, communicating that you're a safe provider to come out to. That can be done in a lot of ways. You don't have to say, hey, guess what? It's okay to be gay. Sometimes it's something just as simple as listing your pronouns, either on your name badge or in your email signature, or having inclusive language in your clinic, both in signage, forms, things like that. There are lots of ways that you can communicate that this is a safe environment for people in this community. The way that we ask questions and the way we collect family history is so important. I'm a healthcare provider. When I go see my doctor, I know why she's asking me about the type of sex I'm having. I know, because she's doing a risk assessment, trying to figure out what I need as a patient. If I wasn't in healthcare, I probably wouldn't know that. And so when our patients come to see us and we start talking about like the different types of things maybe they've done in their transition, right? So in a cancer clinic, if you're thinking about breast cancer risk and you're seeing a trans man who's had top surgery, if you ask about their top surgery, how much breast tissue was taken, how much is left, they may be like, whoa, like, am I a science experiment or a freak show to you? Like, why are you asking? They don't necessarily understand that we're doing a risk assessment for them, trying to figure out the best screening recommendations we can make based on a pathogenic variant that increases their risk for breast cancer. So we need to provide that context for people so they understand why we're asking these questions, and we don't turn them off to thinking that we're just, looking at them through this weird, curious lens and asking invasive questions that don't actually relate to their care. We also need to recognize that family dynamics can be a barrier to family history. So a negative family history in anyone, right, but especially in a community where we know there's a higher proportion of dysfunctionality and poor family communication, can lead to missing information. It can make a pedigree that otherwise would look very striking, very reassuring, and that can lead us falsely to the belief that maybe genetic testing isn't indicated. So we always need to keep in the back of our minds, are there limitations to the family history that's impacting my ability to perform a risk assessment? And in those cases, then you as a provider can decide what to do, right? If you know that you're operating with incomplete information, then how do you incorporate that into the care you provide to the patient? Do you go ahead and order testing even if it doesn't appear to be medically indicated because it doesn't meet the family history criteria? Say, for example, in a cancer setting, maybe you do, and maybe your justification is, I actually can't rule out that there's cancer in this family because we don't know. Pedigree nomenclature. So Robin and a few other authors this year published an update to the pedigree nomenclature. A lot of things stayed the same, but they reaffirmed that for transgender individuals, it is preferable to use the shape that corresponds to the gender identity that they have adopted for themselves. So we are not using shapes that correspond to their sex assigned at birth. We're using shapes that correspond to their gender identity with a notation below of their sex assigned at birth. And the reason we're doing that is because we know in genetics there are times when chromosomes matter, right, in terms of our risk assessment and our counseling for inheritance and things of that sort. So the abbreviation that is used in the transgender pedigree paper, the pedigree symbol paper is AFAB and AMAB for assigned female at birth, assigned male at birth. And so you can see a couple of examples here. It's also okay to use a diamond, and this is actually preferable for individuals who identify as gender diverse or non-binary. So we're not giving them a shape, a circle or square, we're giving them the neutral shape of the diamond, and then again, notating the sex assigned at birth below as it relates to the assessment and counseling that we provide. So a few other things in terms of taking action. I'm going to try and go through this quickly and let you look at it more carefully on your own because we're almost out of time. But different ways that you can communicate that you're a safe space at your clinic. So we talked about signage and using inclusive language. Staff education, I've got some resources at the end of this presentation that are free online trainings. So I think a lot of people work at clinics where it's like, I don't feel capable of providing this training, but my team would love it. Where can I get it? So there are some great resources online, like I said, that are free that you can use to, provide at least a basic background to your staff and start a conversation. And that's nice too, because that gives you the opportunity to participate, but not facilitate or lead. And so if, depending on where you are in your journey, that may feel more comfortable as a first step, and then it can create a place from which everyone else can grow together. So establishing trust and rapport, both with, students and patients, right? So asking without assumption, using open-ended questions, and knowing that some people in the queer community are going to be timid about disclosing those identities to you. You may not get it right away. And Ian and Krista both mentioned this earlier today. Like, contracting is something that never stops, right? We keep doing it because we know we're going to keep getting new information as people get to know us better and start to trust us more. And then absolutely using gender inclusive language. And one of our fabulous second year students, Lex Powers, is for their thesis project creating a gender inclusive language guide that will be made available and distributed more widely after they're done collecting feedback. But that will be coming out very, very soon. We've got a very strong draft of it right now that our second year students started working on last year. And so it's gone through several iterations of feedback and revision, and it's in a really good spot. And I look forward to seeing the final product here in the next couple months. A couple other things to improve your practice. I'll just kind of let you review this at the end. And I do want to end with a case example, because we do have quiz questions for people who are doing this online, and a lot of the answers are coming from this part of the talk. So imagine that you're seeing a 59-year-old trans man in clinic. So this patient uses gender neutral pronouns. So like the they, them pronouns, or the z, here pronouns. Their social transition has, really just been largely switching from more of switching to a more masculine style of dressing and hairstyle. So they have short hair and, wear clothing that is, more commonly seen in individuals who have a gender identity as a male gender identity. Their medical transition, they've been on testosterone since around age 18. They had gender affirming top surgery at age 23 and no other surgeries. And they're coming to clinic because they have a family history of breast cancer. And then it turns out that genetic testing has identified a pathogenic variant in the BRCA2 gene. It's one of the Ashkenazi founder variants. So the questions that we would want to think about for this case is, what pronouns would you use for a trans man who uses gender neutral pronouns? So we already talked about two of those. What pedigree symbols would you use to depict this patient? Anyone? A brave volunteer? Yeah. 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 Great. Yeah. So ask. Yeah. Ask. That's a, yeah. Ask their pronouns. Yep. Don't make assumptions. So ask their pronouns and ask what shape. Yeah. So, for this patient, would it be appropriate to use a square? So the patient's a trans man. Would it be appropriate to use a square if that's what they wanted to do? Yes. Yeah. Because that shape corresponds to the gender identity that they hold. And then what notation would we put below it for a trans man? AFAB, yeah, great. What cancer risks would we need to talk to this patient about? So pathogenic variant in BRCA2, and we're talking to a trans man who's only had top surgery in terms of medical transition. Residual breast cancer risk, absolutely. What else? Yeah, ovarian, peritoneal, fallopian tube cancer. Yep, absolutely. Yep, pancreatic cancer. Would we, yeah. Would we need to talk about prostate cancer risk? No, because we know that this person doesn't have a prostate, right? So in thinking about working with this population, one thing that I always strive for in a cancer setting is talking about cancer in terms of organs, not in terms of men do this and women do this. It's like, here are the cancers that we manage. Here are the risks that we're thinking about based on the variant that you have, right? So, I don't have to tell you about what we do for all women or all men. I'm going to tell you what we do for you, right? And that really gets around some of that like, ooh, how do we talk about this in a gender inclusive way? It's like, well, it's most inclusive to talk about what it means specifically for this patient in a way that's neutral, right? It's objective. It's about the organs that we're going to keep an eye on and the way that we're going to do that. So great. Well, I hope that this was helpful. I will, like I said, send out the slides. I've got a ton of a list of resources for you, a ton of list of resources. Wow. I don't know what happened there. I have a ton of resources that I have collected for you. So as of August of this year, these were all of the publications in the genetic counseling literature relating to the queer community. Lots of other great resources available online. If you don't like the gender unicorn and you want the gender bred person, it kind of gets at that same idea of like gender identity and gender expression and sexual orientation and all of that. If you want to learn more about pronouns, you can go to mypronouns.org. If you want to get into the minutia of pronouns and learn about neo-pronouns, right? So these are things like the they pronouns. You can go to the Human Rights Campaign website on neo-pronouns. There's a great talk that was at NSGC a few years ago. I believe it's still freely available on YouTube. It's fabulous. Kim Zahowski and Talabero gave it. It's great. So it gives you a lot more specifics to clinical practice in genetic counseling. It includes a lot of cancer stuff, but a lot of ped stuff as well. And I think there was some prenatal in there as well. So a really nice comprehensive look at how we can use what we know to better serve our queer patients. And with that, I'm going to go ahead and stop. And like I said, you'll have the slides that you can review later.
Brad, I have a question for you. Can you hear me, Brad?
Yeah.
I have a question for you. Getting back to supervision and supervisors. Yeah. I've heard from some of our students that they're afraid of being misgendered by the patients, not so much by their supervisor. So what does a supervisor do if that happens? Do they just let it go by? Do they talk to to their trainee afterwards and say that? I'm just curious, what recommendations do you have?
So I would want to personally, and then we should open it up to the group. I'm going to move this so I don't keep banging it on top of the laptop. You know, I would ask the student, right, like how they would want me to do that for them, right? So, you know, my own personal experience, like the last thing I want when I'm in a medical setting or something else is to make a big deal about being gay. Like, please, 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 like, let's not like make this a big deal if it, you know, if it's not relevant. And so, you know, as a patient, I would feel comfortable just like letting it go, but I recognize that some people are going to feel differently. So I'd want to know, like, if this happens, you know, as a supervisor, do you want me to jump in and say, oh, actually, you know, they use they, them pronouns, or, oh, actually, they use she, her pronouns. So, you know, some students may not want that attention. That may kind of like make them nervous, but some students may, right? They may want that correction and they may not feel comfortable doing it themselves. Other students may say, oh yeah, I can take that on myself. And so just, you know, take your cue from me. So yeah, I think it just comes back to contracting. But yeah, curious what other people think. Absolutely. So Charisse shared that one way to address this might be to introduce yourself at the beginning of every session using your pronouns, right? So name and pronouns at the beginning of every visit that you have, and have both the supervisor and the student do that. And then you've sort of established that. And then at that point, yeah, you've opened the door to that conversation, and then maybe it would feel a little bit more natural just to jump in and be like, oh, no, they, them pronouns. So. Yeah, so Charisse was sharing that she's learned a lot from the students, and specifically in the prenatal setting, switching from saying pregnant woman to pregnant person, and how initially it seemed like a really big change. And then she was like, well, wait a minute, actually, it's easy once you get in the habit of it. So yeah, and it all came from the student.
All right, well, thank you all. I appreciate all of you for being here on a Saturday again. Yeah, this has been great, and I'm already have ideas how we're going to improve our fieldwork supervision just by listening to all of you too. So thank you. Keep giving us the feedback, keep giving your suggestions, any questions you have. So it's our first year of doing it, so there's so much room for improvement. So I really appreciate everything that you've all contributed with this. So thank you.